Have you ever encountered Tadalafil? Possibilities are, if you've encountered the name, it's been in the context of addressing erectile dysfunction. But what if I revealed that Tadalafil, yes, the same compound found in popular ED medications, has a range of powerful, lesser-known health advantages that go far beyond sexual performance? Today we're going to uncover 5 scientifically backed surprising benefits of Tadalafil that might change the way you look at this medication forever. Before we dive into those advantages, let's take a quick moment to understand how Tadalafil actually functions. Tadalafil is a phosphodiesterase type 5 inhibitor, or PDE5 inhibitor for short. In simple terms, it helps relax the smooth muscles of blood vessels, improving blood flow throughout the body. That's why it's effective in addressing erectile dysfunction. But this mechanism isn't limited to that use. It affects multiple systems, especially when taken daily in a low dose of 5 mg, which is the focus of today's content. Now you might be wondering, what are these other advantages, and are they actually backed by science? The answer is a clear yes. Tadalafil's role as a vasodilator and anti-inflammatory agent opens the door to several therapeutic possibilities. From heart health to brain function, its influence goes much deeper than most people realize. Let's start with the first major advantage, cardiovascular protection, and this one might just be the most life-saving. While most people associate Tadalafil with sexual performance, the scientific community has been increasingly interested in its potential role in supporting cardiovascular health. You see, erectile dysfunction and heart disease often share a common root: vascular problems, particularly issues with endothelial function. The endothelium is the thin layer of cells lining your blood vessels. When it becomes inflamed or damaged, it can trigger a chain reaction leading to plaque buildup, restricted blood flow, and eventually serious events like heart attacks and strokes. Tadalafil, through its vasodilating action as a PDE5 inhibitor, helps improve endothelial function. It enhances the production and bioavailability of nitric oxide, a molecule that keeps blood vessels flexible and responsive. This means better circulation, reduced arterial stiffness, and less workload on the heart. But it doesn't stop there. Tadalafil also reduces systemic inflammation and oxidative stress, two silent but deadly contributors to cardiovascular decline. Clinical studies have shown that men taking daily low-dose Tadalafil experience improved myocardial perfusion, which means the heart muscle receives more oxygen-rich blood, even under stress. And here's where it gets truly interesting. Some trials suggest that in men with pre-existing heart conditions, or those at high cardiovascular risk, Tadalafil could reduce the incidence of major adverse cardiac events, including heart attacks, strokes, and thromboembolism. While it's not a replacement for traditional heart medication, many experts believe it could be a powerful adjunct therapy. In simple terms, what started as a bedroom pill may actually be helping protect your most vital organ: a healthier endothelium, stronger circulation, and less inflammation. That's a trifecta any cardiologist would approve of. Moving beyond the heart, let's talk about something that affects all of us: brain health. One of the most fascinating areas of research around Tadalafil is its neuroprotective potential. While this might sound surprising, the mechanisms actually make sense. Tadalafil's ability to improve blood flow isn't just limited to the pelvic area or the heart. It also enhances cerebral perfusion, which means better blood circulation in the brain. Improved circulation in the brain can lead to better oxygen and nutrient delivery to neurons, essential for maintaining healthy cognitive function. Preliminary studies have shown promising results. Tadalafil may support memory, focus, and even slow down age-related cognitive decline. There's even emerging research suggesting that PDE5 inhibitors like Tadalafil could have a role in the prevention of neurodegenerative diseases such as Alzheimer's. The theory is that by reducing inflammation and oxidative stress in the brain, two key contributors to cognitive deterioration. Tadalafil may help preserve mental sharpness. It might not be a miracle drug, but it's definitely more than just a treatment for ED for aging adults, especially men already at risk for vascular-related cognitive decline. This could be a game changer. And the best part, these advantages don't require large doses. Most of the research has focused on the same 5 mg daily dose used for other purposes, making it a convenient option for long-term preventative care. Of course, more clinical trials are needed, but the current data is exciting and definitely worth paying attention to. Now let's move to an advantage that's already well recognized in the medical community, but still unknown to many patients: Tadalafil as an approved treatment for benign prostatic hyperplasia, or BPH. If you're not familiar with the term, BPH is a common condition as men age, where the prostate gland becomes enlarged and begins to press against the urethra, leading to uncomfortable urinary symptoms like frequent urination, weak flow, and the constant urge to go, even after just going. What many people don't know is that in 2011 the FDA officially approved 5 mg daily Tadalafil, not just for erectile dysfunction, but also for relieving these urinary symptoms. How the same smooth muscle relaxation that helps improve blood flow also relaxes the muscles in the prostate and bladder neck, reducing obstruction and making urination easier and more efficient. This means that with one daily dose, men can experience relief from two of the most common age-related health concerns: erectile dysfunction and urinary problems. That's a major quality of life upgrade, and it's especially useful for men who may not want to take multiple medications, or who are sensitive to other prostate treatments like alpha blockers, which often come with side effects like dizziness or low blood pressure. Tadalafil offers a more tolerable and convenient alternative. And studies have shown that its effects on urinary flow can be comparable to traditional BPH medications, but with the added bonus of improving sexual health. Next on our list is an advantage that often causes confusion, and it's time to clear things up. There's a common misconception that medications like Tadalafil raise blood pressure because they sometimes cause flushing or a warm sensation in the face. But the reality is the exact opposite. Tadalafil actually helps to lower or stabilize blood pressure. As a vasodilator, Tadalafil works by widening blood vessels, which in turn reduces vascular resistance. This effect can lead to mild reductions in blood pressure, particularly in people with hypertension or borderline high blood pressure. In fact, some studies have explored its potential use as an adjunct treatment for hypertension, although it's not yet approved specifically for that purpose. Now it's important to clarify something here. The drop in blood pressure from Tadalafil is typically gentle and steady, which is why the medication is generally well tolerated. However, combining it with other vasodilators, especially nitrates used for heart conditions, can cause dangerous drops in blood pressure. That's why Tadalafil is strictly contraindicated for people using nitrates. It's not about the medication being unsafe on its own, it's the combination that creates risk. So if you've ever hesitated to consider Tadalafil because of blood pressure concerns, know that for most people, especially those not on nitrate therapy, it's not only safe, it may actually contribute to better vascular health overall. And that brings us one step closer to our final and possibly most surprising advantage. Finally, let's talk about the advantage that surprises even some healthcare professionals. Tadalafil may actually help prevent erectile dysfunction from developing in the first place. Yes, you heard that right. Beyond treating ED, this medication might protect men from experiencing it down the line. Here's how it works. Erections depend on healthy vascular and endothelial function, and over time, that system can degrade due to aging, inflammation, oxidative stress, and even lack of regular sexual activity. Tadalafil helps by promoting consistent blood flow to the pelvic region, which improves oxygenation and supports the natural process of spontaneous erections, like those that occur during sleep or early in the morning. Why does that matter? Those nighttime and morning erections aren't just biological quirks. They serve a critical role in keeping penile tissue healthy. When these stop happening regularly, men can develop fibrosis or atrophy in the erectile tissue. Tadalafil helps maintain those natural processes even when sexual activity is infrequent, thereby preventing disuse-related damage. Some experts now view daily low-dose Tadalafil as a form of vascular rehabilitation, especially in men with early signs of ED, or those at high risk. Tadalafil isn't just for erectile dysfunction, it supports heart health, brain function, urinary flow, blood pressure, and may even prevent ED before it starts. Just 5 milligrams a day, one small pill, 5 powerful advantages. If you found this helpful, hit that like button, drop a comment and subscribe for more real science-backed health advice, because your health deserves better than just hype. It deserves the truth.